Kiran from fourth. Assalamu alaikum. This is Kiran from fourth year MBBS from Dhaka University of Medical and Health Sciences, Jamshedpur. The topic of my presentation is to compare the difference of lipid profile of premenopausal and postmenopausal women of age 45 to 60 and what changes leads to increased risk of cardiovascular diseases in postmenopausal women. Cardiovascular diseases are a major cause of morbidity and mortality worldwide. Studies have shown that women are at lower risk of developing cardiovascular diseases than men, but this advantage seems to abolish once she reaches a stage of menopause. Menopause refers to cessation of ovarian function and transition of a female body from reproductive to non-reproductive phase of life. When a female reaches menopause, her body experiences several changes like hot flashes, night sweats, mood swings, etc. Research shows that estrogen has cardioprotective effect that makes a female less susceptible to developing cardiovascular diseases. At menopause, the abrupt decrease of estrogen causes postmenopausal women prone to develop any heart-related diseases. Through this study, we compare different factors that can be cause of more prevalence of diseases in postmenopausal women when compared to premenopausal women. The objective of our study are to compare the lipid profile of premenopausal and postmenopausal women, assess the changes in lipid profile after achieving menopause, changes in BMI, waist and chest circumference between these two groups. This is a cross-sectional study. We collected the blood samples and filled the questionnaire form from the patients in hospitals of Hyderabad. The inclusion criteria are the healthy postmenopausal female who have reached menopause 1 to 5 years back and women of 40 to 55 years who have not achieved menopause yet. Female who have achieved menopause less than 1 year back or more than 5 years back are excluded from this criteria. Assalamu alaikum. This is Kiran from 4th year MBBS from Dhaka University of Medical and Health Sciences, Jamshedpur. The topic of my presentation is to compare the difference of lipid profile of pre- and post-menopausal women of age 45 to 60 and what changes leads to increased risk of cardiovascular diseases in post-menopausal women. Cardiovascular diseases are a major cause of morbidity and mortality worldwide. Studies have shown that women are at lower risk of developing cardiovascular diseases than men, but this advantage seems to abolish once she reaches a stage of menopause. Menopause refers to cessation of ovarian function and transition of a female body from reproductive to non-reproductive phase of life. When a female reaches menopause, her body experiences several changes like hot flashes, night sweats, mood swings, etc. Research shows that estrogen has cardioprotective effect that makes a female body less susceptible to developing cardiovascular diseases. At menopause, the abrupt decrease of estrogen causes postmenopausal women more prone to develop any heart-related diseases. Through this study, we compared different factors that can be a cause of more prevalence of disease in postmenopausal women compared to premenopause. The objective of our study is to compare the lipid profile of pre- and postmenopausal women, assess the changes in lipid profile after achieving menopause. We also study changes in BMI, waist, and chest circumference between these two groups. The study is a cross-sectional study. We collected the blood samples and filled the questionnaire from the patients in hospitals of Hyderabad. Healthy postmenopausal women who have reached menopause 1 to 5 years back were included in the study, and women of age 40 to 55 years who have not achieved menopause yet were also included in the study. Female who have achieved menopause less than 1 year or more than 5 years back were excluded from the study. Okay, this is the age distribution of our population. We have the postmenopausal women of 40 to 45 years were 23.3%, 46 to 50 years were 23%, 51 to 55% were again 40%, 56 to 60 years were 13%. And premenopausal women of age 40 to 45 years were 60%, 46 to 50 years were 10%, and 51 to 55 years were तरीके से. Okay, as we can see that the total cholesterol level in postmenopausal women were 186.46, which is above normal. And the value of LDL found in postmenopausal women were 114 compared to premenopausal women, LDL levels of 98. HDL levels were significantly decreased in postmenopausal women, 38.6 compared to premenopausal women having HDL levels of average 52.3. BMI was increased, waist circumference was increased, chest circumference found to be increased in postmenopausal women. Okay, this is the comparison of LDL and total cholesterol between these two populations. As we can see from the graph that there were significant increased value of LDL in postmenopausal women when compared to premenopausal women. Total cholesterol was also increased in postmenopausal women than premenopausal women. This is the comparison of HDL between these two groups. The HDL was significantly decreased in postmenopausal women. As we can see from the graph, the premenopausal women have significantly higher levels of HDL when compared to postmenopausal. This is the comparison of BMI, waist, and chest circumference between these two groups. The BMI was found variable between these two groups. Some patients had increased BMI in postmenopausal women group, and some patients has normal BMI in premenopausal women, and while increased BMI in premenopausal women too, depending upon the lifestyle. Waist circumference was increased in postmenopausal women, and chest circumference was also increased in postmenopausal women when compared to premenopausal women. So, in our study, we concluded that there are significant changes in lipid profile of postmenopausal women when compared to premenopausal women. Like there was increased LDL and total cholesterol, which can be a cause of increased incidence of cardiovascular diseases in postmenopausal. HDL levels, which is a good cholesterol, which seem to be decreased after menopause. BMI, waist, and chest circumference were also seen to increase after menopause. So these all results suggest that why there are increased incidence of cardiovascular diseases in postmenopausal women, and premenopausal women due to a sufficient level of estrogen are protected from these diseases. Thank you so much.